Welcome back. I'm here at the ATP Therapy Center, Coherence place in Hamilton, where we have the Thor laser here and the Novothor, which I'm going to go into a minute later. So the reason I'm here today is for my sciatic pain, which has come back in full-fledged. I don't wish chronic pain upon any human being. Unfortunately, there's too many of us around the world suffering and struggling with chronic pain. So if you know what sciatic pain is, it's basically shooting pain from the sciatic nerve, which is between lumbar 4 and 5, starting there, the whole coccyx area there, shooting around the side and all the way down the leg, so it's like on fire. Been having this for years now, and comes and goes, and sometimes locked back, and chiropractics and acupuncture and stretching and all that. Helps, doesn't go away, comes back again, and all these things, but nothing relieves that pain like since I started using all these low-level lasers and then going to the Novothor, which I'll show you later today. So after 2 hours of a drive here, where Mata was driving, not me, because I can't even drive properly with this, because I did not take my Voltaren today. The only reason I've been functioning for the last week and teaching and doing the dentistry and all that stuff is because I've been living on Voltaren. Now, thank God we have some medication for pain, but it's not something you want to live on. Nobody should live on painkillers because you can't anyway. At some stage your stomach gets upset and acids and ulcers and all these things, and you can't even take the painkillers. Ask anyone who's been on chronic pain, and you might know what I'm talking about if you have it. So, only way to get rid of true pain is reduce inflammation, because it's all about inflammation. Reduce whole body if you can, or at least the localized area. Inflammation, increase blood flow, increase oxygenation, activate every cell through the activation of mitochondria, all at the same time. And that can only be done with photobiomodulation, either low-level lasers or LEDs or combination of both, which is what actually we're using here. But the whole concept is called photobiomodulation. So I'll show you a couple of things before I go to the Novothor. Sorry. Other than not being able to stand straight, if we put the thermal camera, I've got a thermal camera attached to my iPhone that will just show you through. So this is the bad leg, the fire is down here. You'll actually be able to see that there's a whole different pattern of blood flow and temperature. And does it look different? You can see that? Yeah. So I'll step one leg out of the way so it can measure the temperature on this one leg. And you probably will see some degree or a couple of degrees difference when it just clicks on now. It will take another measurement versus this leg, which I'll wait until the camera clicks on that. Was there a degree or two difference in temperature?
I think so.
Yeah, this was in the 20s, 28 or something. This is 30. So you can see the different pattern of blood flow and resistance and all that, but also you can see that, well, now when they're both together, it's just measuring the hotter one of the two, but when you take one out, you see lower temperature, or you will see when it clicks again, because it's taking a measurement, versus the other one. And it will click again. That's an infrared thermal camera. There we go. And the other thing you can see quite clearly is resistance. So the beauty of the Thor laser is that it's got a resistor measuring skin resistance basically, so whether it's constrictions, reduced blood flow, inflammation, all that, it actually gives you obviously a higher sound, higher beat, because there's higher resistance in that area versus low resistance somewhere else. So it's a probe like this on the one hand, so the fire is right here, right there in my back. I'm going to show you my back right now. I'll just work on the leg. So, extremely high number, extremely high resistance. So it's telling you this area, and of course in this case there's many areas, high resistance, high inflammation, high tension there, versus the same areas on the other leg. Of course there's skin resistance. That's what it's measuring actually, but that was about 1500 before. Now we're looking at 700, 800. So it's half the resistance, half the strain on this side here. So this is how we know with these probes, especially when we're doing head and neck and trigger points and all that, how we know exactly where the trigger spots are electronically through body resistance, other than just pressure and injections, which we don't need to do injections and inject trigger points and all that if you're using the proper lasers and the proper protocols for healing of pain, reducing inflammation, like I said, releasing sore muscles and all that. of course, nothing compares to the Novothor bed, which I'm going to go into later on. After this video, we'll record that and I'll show you what the outcome is. You know, with the thermal camera, where you get complete full body coherence of all your cellular activity. It's not activating one part or one point of your body, and that's good. And that's good for many things. But full body synchronicity and coherence from head to toe. Coherence is something a word we use from laser science and light science, and synchronicity is just human science, basically synchronizing your energy fields and all that stuff. That synchronization and coherence that happens in addition to individual parts of activating, you know, each and every cell and releasing the blood flow and toxins and inflammation, all these things, is just incomparable. You cannot compare that to anything else that I know of, and I've been studying this for many, many, many years. Nothing compares to that. And nobody will understand exactly what this means until they experience it. The science is there, the studies are there, whatever is there, but when you experience it as a human being, no one needs to tell you anything. You just know. And when you know, that's it. You're getting better and better every day. So I'll do some of this laser therapy on my, this is an infrared laser, so I'll be doing some of that on my back here now for about 5 to 10 minutes, where the sciatic nerve starts, before I go into the laser bed, and I'll see you on the other side. Take care.